All right, so now we're going to get into more of what the treatment plan would be for a chronic ankle sprain. This would be an ankle sprain where if you've been going and walking outside or on any uneven ground, there's the potential then that when you sprain your ankle and then that initial ankle sprain heals, that you've distended the ligaments that we talked about on the outside here, here, and here on where that ankle is being stabilized. And those have been distended to the point that now it is perpetually a weak ankle. It's called ligamentous laxity as a result of trauma. What will end up happening, and some good ways to know if you have a weak ankle, is if all you have to do is just walk and just step on a crack in the sidewalk and you feel that give of your ankle. Some people even get a full-fledged ankle sprain again just from something that simple. If you're starting to develop a ligamentous laxity, or if you know you have a ligamentous laxity, you're spraining your ankle frequently, then you absolutely need to be seen by a podiatrist soon. What can happen is if that's left unchecked, then you could end up developing arthritis in that ankle joint. That could end up being then a long-term issue that may require surgery with various degrees of and levels of recovery time. So what do I do when I have somebody come into my office and describing this ligamentous laxity in their ankles? First of all, what I do is I determine with an x-ray if there is already arthritis involvement. Number two, I determine also the frequency of what's developing, how frequently their ankle sprains are. And so after we've determined that together, if they're at high risk, then I will stick them into a brace immediately and also send them for physical therapy to have them start working on strengthening those ligaments. We even have a worksheet that patients can use to determine the different stretching exercises and how they feel. If they are able to do the stretching exercises on their own, maybe they can avoid formal physical therapy, but usually formal physical therapy is needed. Now, if we're finding that there still is exceedingly amount of laxity and despite therapy, whether it's stuff you're doing with worksheets that I have or at home based on exercises that you've gotten from physical therapy, it still is not working, then we would end up having to talk about surgery for this. And that would mean going in and actually reefing up those ligaments and making sure that they're nice and stable. We'll turn on your notifications so that when these videos come onto our YouTube channel, you'll be informed. But thank you for watching.